area 4, which is conduct, evaluation, and research. So just as Dr. Crossland mentioned, evaluation is really about how do you know if your program is successful. And the best type of evaluation really starts at the beginning of program planning. It is not something that is done independently. It should start at the very beginning based on the goals and objectives that you set. So interestingly, I was called in recently to do as an external evaluator of a preventing adolescent pregnancy program, and when I asked the group for their goals and objectives, the overarching goal is to prevent teen pregnancy, but when it came time to goals, their objectives, they were just stated as keeping girls from getting pregnant. Well, how do we know that we can measure that? Well, we can't. So when it comes to evaluation, how can we set goals and objectives that we know that we can come back and measure effectively, that we're actually having specific objectives? So that's what you learn to do in evaluation, specifically in the program evaluation class, is learning how to evaluate programs, making sure that your objectives are measurable, and then also once you have measurable objectives, how are you going to measure them, with what type of surveys or instruments, how are you going to collect that, and collecting the data, how are you going to actually administer the surveys, are you going to do a pilot test and then measure, then make changes, then go back and reevaluate again. So just as Dr. Crossland was talking about pilot testing, those are all things that we do in as a health educator, is program evaluation. And then also, once you collect the data, knowing how to interpret the results and actually apply the findings. So being able to look at the evaluation and say, okay, well, we didn't reach as many people here, or the people that we were able to reach, 80% of the women that participated were kept, from getting pregnant within the first year, or, something along the lines of that. Also, in another class that you use for research and evaluation is epidemiology, and that's a lot of mathematical figures and, looking at community health overall. And some of the things that you'll learn about are reliability and validity, cost-benefit analysis. So, again, that's part of evaluation. How is your program working in terms of the cost? Is it worth it? Are you spending too much per participant in order to do the program? Also, we'll cover ethical principles in research, obviously, in terms of everything being voluntary, that participants, program participants are participating in, and that also that everything we're doing is practice is evidence-based, and that you can say that your program is great, like let's say you're planning a program in your program planning class, but how can you know it's great unless you actually have evidence to back it up? And so that is really the key part of evaluation and research. Next is administer and manage. And as you've heard us already mention, health education specialists, right? We work with a lot of people. We have our hands in a lot of different pots when it comes to health education, whether that be managing budgets, obtaining support, whether that's community support, whether that's financial support in terms of maybe writing grants. We'd have to demonstrate leadership. Oftentimes we might be called in to lead a coalition, and so we might be needing to put together 4 or 5 different organizations together. There's like a Dallas Area Coalition for Obesity Prevention. That's actually 18 different organizations, and a health educator, I believe, from the Communities Foundation maybe runs that. So, that's just an example of demonstrating leadership. She leads that overall group. You may have to train or hire personnel to work under you to help with the grant writing, to help administer the program. So program planning obviously is going to help you with this, and then grant writing also is a great opportunity to learn about where to find funding for programs and how to apply for grants. And in those classes you learn obviously fiscal management, all about budgeting, human resources, different leadership styles, public relations, obviously that is a key piece, and team building, as I talked about in terms of coalitions and advocacy. Another important area, area 6, is that you serve as a health education resource. I think that many of you will see as you go through your degree and you tell people you're a health educator, whether it's on an airplane or at the park or somewhere, people start saying, hey, well, I had a question about this. So you really do become a community resource person. You also can serve as a bridge between clients and other health providers, providing information to different clients. You might be called upon, to identify valid resources and consumer information. One thing in health communication is that if there's new research that comes out, in journals, we take that information and we actually put it into a public service announcement so that the average person can understand what that study means, so that we can convey the information accurately, because we all know in this internet age that there's so much information out there, that how do we know that what we're getting is accurate? So that is one, big critical role right now of health educators, and that you also just provide expert assistance in all of the different areas of health education.
Okay, moving on to the last area, which is communicate and advocate for the health education profession. You'll find that health educators may advocate for legislation to pass to protect the health of communities. If you would consider with me a situation, let's say that a neighborhood which is adjacent to a busy road has seen several pedestrian injuries. A health educator may work with that community to advocate to city leaders to pass a city ordinance, maybe to install speed bumps or lower the speed limit in order to protect children and any other people who travel along those busy roads. So health educators are very much in the community, and they can work with policy makers and as a way to improve legislation, and with the effort, with the meaning to actually protect the environment and help people. So it's a really great way to help others if you are interested in looking at policy change and social issues such as that, for one example. You may also, if you like advocacy, you may decide to advocate for the health education profession at large. Oftentimes people have a hard time understanding what health education is, and we do bring a lot of skills to the table. As you can see, we've listed skills for each of the areas, and those are only just a few. There's several that you'll learn in this program. And so helping people understand what we do in our profession and how we really can work with other health professionals and other people in the community to achieve more wellness in our communities is really critical. So, that's one thing you'll learn through your classes, such as health communication. You may have noticed so far in this presentation that communication is really critical for a health educator. You'll need to know how to communicate with all different kinds of people at in different ways, maybe at different literacy levels, and be able to communicate with scientists and health professionals, and then community lay members, and so forth. And so that class is really critical for you. As well as global health is advocating for people in a larger setting. Perhaps you're interested in overseas work. You may really find an interest in global health to prepare you for that, as well as community health. So this is really the heart of what we do, is working with communities and doing grassroots work, which means you start from the bottom, you help communities and you empower them so they can learn what skills they have and how they want to improve their own neighborhoods. And then they go and their voices are strengthened, so to speak, and they can work with legislators and city officials to then improve their own living situations and their own health. So oftentimes, there's the top-down approach and the grassroots, and so we're very much grassroots, and we really hold fast to the tenets of empowerment and education and advocacy, and that's really the heart of what we do in health education. And in conclusion, we hope that you've learned a lot about this program and what you will encounter in your classes. These areas of responsibility really help bring structure to how future health educators are prepared and then once you graduate, on how to further improve your skills and how you can apply them in work situations. So all of your classes will help you prepare for the CHES certification, and we hope that you'll consider taking that, because it really does bring recognition to the fact that you've been prepared and that you have met all of the standards set forth by NCHEC, and that you are an example of a health educator that is professionally ready to help communities. You may also decide to pursue an advanced degree, and so this would prepare you for that as well. And I hope that you can see that there are several different applications for a health education degree. You can see that there's management, there's leadership opportunities, so you may like the business side of things and working maybe in grants management and hiring and training people. You could also, if you really like evaluation, there's program evaluation jobs out there, and you could work within that area of responsibility. And so there's many opportunities. You'll learn all of the areas, but then you may want to focus on one or two or three, depending on what you find most interesting. So thanks for listening, and we'll see you when you take your classes.
Thank you.